Welcome to another Ask Dr. Vaughan on YouTube and on Periscope Live. We have two audiences here going on two different cameras at the same time. The audience on YouTube, we are talking about lymph nodes, swollen lymph nodes and why they get swollen and what to do about them. Oftentimes people will feel in their neck a lump and get concerned because lumps go along with bad things and tumors, and so you want to make sure that it's not a cancer. Well, swollen lymph nodes are actually a very common thing, and people will get them from something as small as just an infection on the skin, like a pimple nearby that drains to that area, or having an upper respiratory infection. Swollen lymph glands are famous for going along with strep throat, but also along with mononucleosis, the kissing disease. So these are things that we see in primary care quite often. A swollen lymph gland is caused by inflammation. Inflammation occurs whenever there's some kind of an injury to the body. Oftentimes we associate it with infection, although not exclusively, as we learned with inflamed sebaceous cysts that can enlarge and sometimes rupture. An inflamed lymph node, you have the four cardinal signs of inflammation, which are redness, swelling, pain, and warmth. You get these four markers of inflammation whenever there's some kind of an injury or infection. In the lymph nodes, it's no different. And this is where you're having white blood cells kill or attack some kind of offense. Now, it may be nothing, as is the case with sebaceous cyst. I shouldn't say actually nothing, figuratively nothing. Like when a sebaceous cyst ruptures in the skin and you have this material that the body views as a foreign invader, even though it's just sebaceous oil. But it's not supposed to be inside of the skin, and so the body attacks it with white blood cells, and they have these chemicals that come out, and there's also a certain type of white blood cell called a phagocyte. Phage, or phago, means eat, and so it engulfs whatever it's trying to get rid of, and it, in essence, digests it, breaks it apart. And when this is going on, there's increased blood flow, which causes you to have more fluid, which makes it larger. The blood is warm, makes it warm, so you get your warmth and your swelling, both from that. You also get the red color because of increased blood flow. That's what the redness and inflammation is from. And this can happen in a lymph node. And in fact, it can happen so much so that you can actually see the redness from the outside. Oftentimes you can't. You just feel, oh, that's sore, and there's a lump there that wasn't there before. Well, there was something there before. There was a lymph node there before, but now it's enlarged. And that's why it draws attention to itself. Enlarged lymph nodes in the setting of something going on, like an infection in the skin or an upper respiratory infection, that's fairly normal. You may have enlargement in that lymph node last for a long time. Some people do have these lymph nodes that you can feel in their neck that just stay after a period of inflammation, and it's from fibrosis or a scarring type action that occurs, and then they just stick around. You always feel them even though they're not inflamed and they're not enlarging and they're not hard. We get worried about hard enlarging lymph nodes because that can be something bad like a lymphoma or a leukemia occurring, and that needs to be checked out. But the ones that are tender in the setting of something that should be tender because you have something going on like an infection in the area, those you can give a few weeks to go away. Now, I'm not going to tell anybody that this is medical advice that you should not get your swollen lymph glands checked out. Not at all. This far be it from the truth. I would want you to get it checked. Now, somebody is writing in with a question about the words palpable and movable. Palpable means you can feel it. Movable means you kind of move your fingers around and you can actually feel the lymph node moving under the skin. If it's not free to move under the skin and feeling like it's attached, that's absolutely something to get evaluated immediately because that's concerning for some kind of invasive growth. Now, I talked a little bit about lymph nodes draining an area, and that's what happens. We have lymph nodes in the neck and they drain the lymph areas or the lymph channels that come from around the face and neck. We also have lymph nodes in the axilla or armpit, and these are famous in the setting of breast cancer because these are the lymph nodes where oftentimes there'll be a lump that is from a spreading of a breast cancer, the breast on that side of the body, to that axilla, and those axillary nodes are checked, and that's actually part of a breast examination that a doctor does annually on female patients. You know, you also have some lymph nodes in the elbows that these, as a primary care and former emergency physician, I associate the lymph nodes around the elbow with cat scratch fever, because generally people get cat scratches on the hands, where else? And the first thing that you'll find is that in addition to them feeling sick is this sore swelling around the elbow. And then they can drain even further to the lymph nodes in the axilla. You notice I messed up and I said lymph glands, because oftentimes people are talking about swollen glands. Well, it's not actually glands like the salivary glands that get swollen with something like mumps, but rather lymph nodes. Now, somebody was also asking, actually it was Danielle from Ypsilanti, Michigan, who was asking, can you get swollen lymph nodes in the groin? And absolutely, that's another common location that we check for lymph nodes, is right in the inguinal region, or the area where your thigh comes together. Let's see, do we have our friend in the back? Here are the lymph nodes. Can you see the lymph nodes on Francis? These green lines here represent lymph channels. Lymph channels drain fluid from the body, or help the body that has fluid that's coming out of the arteries and didn't go back in the veins and just kind of sits there. It gets drained by these lymph channels, which eventually go back into the circulation near the heart. And these little green spots represent lymph nodes in the groin area. And you can have drainage of material to this area of the lymph nodes in the groin if you have, say, an infection in the leg or anywhere in the, well, I was going to say lower extremities, but that's what the legs are. You can also get them inside of the abdomen, but those you can't feel because they're way deep inside behind the internal organs. These are places that doctors check, surgeons check, when they're operating on people with cancer, to check for spread of the cancer that they're operating on. Of course, if the cancer has spread to the nearest lymph node, that means it goes up a grade, staging. I'm sorry, I said grade, I should have said stage, because grading is something different. So you have stage 1 through 4 cancer, and when you have it going to the lymph nodes, then you've reached stage, it depends on the cancer, but stage 2 or 3. So I hope that gives you a little bit of understanding of what this whole thing of swollen lymph nodes is about. If you guys have any questions, you can go ahead and write them in the comments below on the video. We want everybody on Periscope and on YouTube to follow us at the Auburn Medical Group channel and send it to your friends and share it with your family, people who you want to get good, accurate health and medical information to. And of course, you can always write in questions either through the Periscope, the Twitter, or the comments on the YouTube. Until next time, this is Dr. Mark Vaughan telling you to stay in good health.